everybody, it's Charlita, aka Miss China D, and this is my second vlog, as I was told to say by my manager, aka my little brother. So instead of calling them video diaries, I'm gonna call them vlogs now. As you can see, I'm in the hospital. Yep, I'm getting blood. Whoever says what I go through is nothing, you're totally wrong. So it is now like 2 in the morning, and I'm sitting up in pain, but I said I'm going to make a video because I said I was going to start doing this, and I'm totally committed to it. So here we go. I'm going to talk a little about what sickle cell is. Sickle cell is a blood disorder. It basically is, my red cells don't contain enough oxygen to pass through my body. So when I go into a crisis, the blood, it gets kind of sticky. So I'm trying to dumb it down a little bit. It gets kind of sticky, so the cells stick to my veins, mostly in the joint area, anywhere that bends, and it basically blocks off any blood flow to that area. And when blood cannot pass, that means a lot of pain is going to go to that spot. So I'm on medication. I take a lot of pain medicine. Morphine does not work for me. And when anybody asks me, do I have a Tylenol or anything, I'm like, I wish. Like, I can't take any type of like over-the-counter medicine for my pain because it does not help me at all. Like, it's hard to explain. I just wanted to get that out there. That's what sickle cell is. It's a blood disorder, for those who don't know. I don't want to get too in-depth into it now because I want to talk about my hospital stay right now. I might be smiling, but but I'm not happy right now. I'm in like so much pain. The doctors aren't helpful at all. I just hate the fact that the reason why I prolong going, like, I don't like going to the hospital because every time I come, it's the same old thing. So when I come, I'm thinking, no, don't go, because people are going to talk about you if you go. And trust me, I deal with that almost every day. You have no idea. People don't know that it gets to me, but it does. And I'm speaking out about it because I'm tired of it. And I have a problem with people talking about it because in my mind, like mentally, people don't know what that does. If somebody says they have an illness or somebody's going through something, please do not tell them otherwise, because you're not walking in their shoes. You don't know what they feel. You don't know what they go through. So it's hard to say something about someone when you have no idea about whatever they're going through. So when somebody says, ow, my toe is killing me, I'm not going to say, no, it's not. Your toe looks fine. I'm not going to say that because I don't know, and I'm not in your body. I can't feel your pain. So don't tell me, don't you think you go to the hospital enough? That's not cool. You don't do that. And to me, I take that to heart because you don't know what I deal with on a daily basis. Like, I have pain. I have chronic sickle cell now, so I have pain every day. I have dealt with so many people telling me what I feel. And when I finally decide that I'm going to go to the hospital, what do I deal with? The most helpful doctors in the world. I lied. These doctors, they don't understand. They of course they say they listen, but they really don't. Okay, so I've been basically battling with this doctor ever since I've been in here about my pain medicine schedule, what I feel might work for me. The first day, he listens. Second day, I'm like, he tried to send me home. And I'm telling him, no, I don't feel well enough to go home. Why am I going to go home just to come right back? No, I tried it your way. It's not working. Okay? So I just hate dealing with this stuff. And it's hard to fight alone. I'm in this hospital all the time by myself. I deal with this stuff. Nurses, doctors, everybody treating you like crap because you're always alone. I have nobody to fight in my corner unless my mom will. She'll call and then they start acting different. But I shouldn't have to. I'm a grown woman. I should not have to have my mother call for you to actually want to do something. No. And you know what? And I try. This is why I fight back a lot, because if I don't, I'm never going to get respected. You're just going to sit and treat me like a little kid and give me whatever you decide to give me. That's not cool. It's not right. You should, I swear, doctors should listen to patients because they don't feel what they feel. And this doctor, his name is Dr. Malik. Every time I get him, I basically shut down. I'm like, it's over for me. I'm going to be in pain the whole time I'm in here, because the first day, of course, he'll do whatever because the admitting doctor gives me the orders and he doesn't touch anything. But as soon as he starts working, it's over for me. I'm just tired and frustrated, and everything I have to deal with is it's not cool, you know. And I'm 26 years old. Of course, I'd rather have a life. I'd rather have a life out there like someone normal. Normal, able to go out when they want. When I go out, I have to watch what I do, because I'm afraid if I do go out, I'm going to end up hurting later for just having a good time. So, it's like I said, of course, I do go out, and that's because I try to feel normal. So I'm like, of course, I know people are watching this and feeling like you are normal to a certain point. I still have to watch what I do, because I know that if I do something wrong, I'm going to end up in the place that I hate to be, which is this lovely place here, having blood hooked up to me and just dumb stuff. I'm just tired of dealing with it all, but I'm strong and I'm not going to let it beat me. I'm going to get the blood, do what I have to do, get the fluids, get everything, because I'm not going to let it beat me. I'm going to go through all this because he knows the man above. He knows I can handle it. He puts me through it because he knows I can take it. But I'm going to keep doing what I got to do, and when I get out, I'm going to live my life. I'm going to do what I do, and if I start to feel the pain again, I'm going to do it all over again. But I don't let it stop me. But this is just some of the stuff I go through. Of course, I got to learn how to let people talk and ignore them. Sometimes that is hard. And I know some of my friends that I grew up with that have sickle cell know this. It's very hard, because sometimes words can hurt. Yeah, I heard of sticks and stones can break my bones, but sometimes words can hurt too. And I'm just like tired of it. Like a lot of people, you know, hurt me with words. They always say, oh, like, you're still in the hospital, or You go into the hospital again, or even the nurses. Miss Hodges, you're back again. Weren't you just here? Then you just see me? Like, I get kind of smart mouth because I'm tired of dealing with people that's just going to keep, you don't know what I go through. You don't feel what I go through. So, this is just a late night video upload, so just had to get that off my chest. I'm bored in here, so I figured, hey, let me add another video. This is video number 2 to my collection. I hope you guys are enjoying this. I know I look a mess. I had to put on some eyeliner. I didn't want to look too out of it. But I am feeling a little bit better since I've been in here. Not 100%, but I'm getting there. So hopefully the next couple days I'll be able to go home and, I guess go home and do what I do, hang out and watch my nephew. I can't wait to see him. So I guess I'm about to go lay down and do something, wait for this blood to finish. But I want to thank you guys again for watching this video, whoever does, so I'll be sure to add another video soon. I'm going to try to do it at least once a week, kind of vent and get my stuff out there about what I deal with sickle cell and all that. So thank you, and I hope everybody has a good night.